Welcome to the Deep Dive. Today we're taking a closer look at brain magnetic resonance imaging, MRI.
That's right.
You sent in some really great material, and, well, our aim here is to really get into what makes MRI so powerful, you know?
Cut through the complexity.
Exactly. Think of this as your clear guide to brain MRI. We'll look at why it's so good for the brain, how it's actually used day to day, the really cool science behind it, and why it's just so crucial now.
Okay, let's unpack this then. So fundamentally, MRI is non-invasive, right? That's a
Mhm.
big deal. No radiation, unlike, say, X-rays or CT scans.
Absolutely key. And it's real strength.
Yeah.
Imaging soft tissues.
Which the brain is full of, obviously.
Precisely. That's why it's perfect for the brain. The detail you get of the brain structures is just, well, exceptional.
Better than other methods.
Oh, much better for many neurological
Yeah.
issues. Much higher resolution. Plus, we have flexibility. We can use contrast agents.
Like special dyes. Sort of, yeah. They highlight specific things. And we use different imaging sequences, like changing camera filters to see different features.
Got it. So it's more than just a static picture. How does that translate into actual use for doctors, for researchers?
Well, a major use is something called image segmentation. It's like digitally dissecting the brain image.
Okay.
Allows us to measure structures very precisely, track changes over time, maybe spot problem areas that are quite subtle.
Like having a super detailed internal map you can measure. And I gather it's not just for diagnosis, for finding problems.
Oh, definitely not. It's huge in treatment now, too. Take MRI-guided radiotherapy for brain tumors.
Right.
The precision is amazing. Target the tumor, spare the healthy stuff around it as much as possible.
Makes sense.
And for neurosurgeons planning tricky operations, it's invaluable. Gives them a 3D preview.
Right.
Even for neurointerventional procedures, those minimally invasive things, they need special non-magnetic tools, but MRI can guide them inside the brain.
Okay, let's switch gears a bit. The science behind it. This is where it gets really interesting, right? Magnets and atoms.
Exactly. It all hinges on hydrogen atoms. We have tons of them in our bodies, especially in water and fat, which are, abundant in the brain.
Okay.
Hydrogen.
And each hydrogen atom's nucleus spins, creating a tiny magnetic field, like a microscopic compass needle.
Right.
So you put the patient in the MRI machine's powerful magnetic field, and all these tiny compass needles, they line up. They align with that main field.
Okay, so step one, alignment. Like soldiers falling into line. What next?
Next, the machine sends out a quick pulse of radio waves. But it's at a very specific frequency.
Like hitting a specific note.
Kind of, yeah. Only the hydrogen atoms hear it, they absorb that energy, get knocked out of alignment with the main field, they get sort of excited and wobble.
So you knock them off kilter with radio waves. Then what?
Then you just wait. They naturally want to relax back into alignment with the big magnet. As they do, they release that energy they absorbed.
As their own faint radio signals. And the MRI machine's receiver coils, they pick up these signals.
Okay.
Now, here's the clever part. Hydrogen atoms in different tissues like gray matter, white matter, spinal fluid, they relax back at slightly different speeds. And they give off slightly different signals as they do.
So the machine listens to these like tiny whispers coming back, and because different tissues whisper differently, that's how you build the picture, showing the contrast.
You've got it, exactly. The machine detects all these subtle signal variations and uses some pretty complex math to reconstruct a detailed image based on where those signals came from and how strong they were.
That's fascinating. Okay, so before someone actually has a scan, there must be checks, right? Safety things.
Oh, absolutely. Safety first, always. There's a thorough assessment beforehand,
Right.
checking for any contraindications, things that would make the scan unsafe.
Like metal implants.
Exactly. Pacemakers, certain clips, cochlear implants, per loose. Also, physical limits. The table has a weight limit, and the opening, the bore, is usually around 60 centimeters wide, so the patient needs to fit comfortably.
And claustrophobia could be an issue for some people too, I guess.
Definitely. It's something we always ask about. Knowing the bore size helps, and the medical team needs a plan. Meaning they need to know why they're scanning. What are they looking for? A scan for headaches might use different settings, different sequences, than one looking for signs of a stroke or a tumor.
Right.
That's why the info from the referring doctor is so important. The clinical history, the symptoms, it helps tailor the scan.
So they use standard plans for common things.
Often, yes. Standardized protocols for stroke or suspected MS or Alzheimer's ensure consistency and make sure all the necessary views are captured.
And what about those contrast agents, the dyes? When do they come into play?
Good question. We use them when we need to see certain things more clearly, like inflammation, tumors, or issues with blood vessels. They make these areas stand out.
But not always needed.
Not always. The decision depends on the clinical question. We also have to check kidney function, because that's how the contrast agent usually gets filtered out, and check for allergies.
Right.
And if there's any doubt about hidden metal, maybe from an old injury the patient forgot about, a quick x-ray beforehand can sometimes be done just to be safe.
Okay, we talked about relaxation times creating contrast.
Yeah.
But what else makes different brain parts look different on the image? It seems complex.
It is, yeah. Several things contribute. The amount of water in a tissue is huge, obviously. Also fat content, protein content,
Uh-huh.
even the presence of certain chemicals, metabolic compounds like choline, creatine, and acetyl lactate sometimes. Their concentrations affect the signal.
Wow, so down to the chemical level.
Yep. And molecules with specific magnetic properties like hemoglobin in blood, especially after bleeding, that changes the signal too.
So it's a mix of water, fat, chemicals.
And more. Proton density, just how many hydrogen atoms are packed into a tissue, how easily water molecules move around, that's diffusion.
Diffusion?
Yeah, how water spreads out in tissue. Then there's perfusion blood flow in the tiny capillaries. And even bulk flow, like blood in big arteries or the movement of cerebrospinal fluid. All these things influence the final image.
It's amazing how much information is layered in there. And I imagine the technology isn't standing still. What are the big advances?
Oh, it's moving incredibly fast.
Right.
One huge thing is speed. Scans are getting much, much faster.
Which means less time lying still in the tube.
Exactly. More comfortable for the patient and really vital in emergencies like stroke where time is critical. But beyond speed, it's the new types of information we can get.
What?
Well, advanced sequences.
Yeah.
We mentioned magnetic resonance spectroscopy, MRS. That lets us measure brain chemistry non-invasively.
Like a chemical biopsy without the biopsy.
Sort of, yeah.
Mm.
Then there's DTI, diffusion tensor imaging. That maps out the brain's wiring, the white matter tracks.
Seeing the connections.
Yep. Perfusion imaging shows blood flow, great for stroke assessment. Functional MRI, fMRI, shows which brain areas are active during tasks by tracking blood flow changes.
The one you see with brain maps lighting up.
That's the one. And SWI, susceptibility-weighted imaging, is really good at spotting tiny bleeds or iron deposits. Plus, using stronger magnets' higher field strengths gives us clearer, more detailed images. Really helps when looking at tiny structures or in developing brains.
It's incredible, the range of things you can probe: structure, chemistry, connections, activity. So, okay, the scan's finished. What's the end product? What do the doctors work with?
What they get is a lot of images, hundreds, maybe even over 1,000 high-resolution 2D slices through the brain, usually in different orientations, side to side, front to back, top to bottom.
A whole stack of pictures.
Exactly. And crucially, software can take those slices and build a 3D model.
Ah, so you can see it in 3 dimensions.
Yes, which is fantastic for visualization. Plus, you can do quantitative analysis, measure volumes of structures, signal intensity in specific regions of interest, or ROIs.
Getting actual numbers out of the images.
Precisely. And all this, the detailed images, the 3D views, the measurements helps pinpoint any pathology, any abnormality, and that directly informs how the patient is treated. It guides patient management.
Okay, so bringing it all together, this deep dive really shows MRI as, well, just an incredibly powerful and adaptable tool, doesn't it?
It really does.
It lets us see inside the living brain, non-invasively, with amazing detail about structure, function, disease, and it all comes back to how hydrogen atoms behave in a magnetic field. It's kind of mind-blowing.
It really is. From basic anatomy to complex disorders, it's just indispensable now in medicine and neuroscience. And the technology keeps pushing forward, letting us see more and understand more all the time.
It's been absolutely fascinating. Really makes you wonder, doesn't it? With these constant advances, how much further can MRI go? What new insights into the brain? What new ways to treat its disorders might be just around the corner? Something to think about until our next deep dive.